that baby look like he or she is having fun? No, no. This is a brutal, brutal procedure.
Ruby.
And we do this in almost all babies who are preterm, less than about 32 weeks gestation. Okay? Well, the problem is, we do this in so many of these babies, but very few of them actually have something that we end up treating, okay? So these eye examinations are invasive, they're painful, they have no physiologic effects on the babies, and less than 10% of these infants that are screened require treatment, Avastin or laser, under the current criteria. 80% of the mydriatic treatments enters the nasolacrimal duct and has the potential for systemic absorption. And there's many feared complications, such as cardiovascular, respiratory, central nervous system, and gastrointestinal system problems. Many of these babies just don't feed very well for a day or two after their eye exam. So this is something that it would be really nice if we could eliminate a certain percentage of these. We don't have the answer yet, but we are beginning to work on this with early detection of ROP risk, and this is very important. So what we are doing in the study that is currently ongoing is we are applying unsupervised machine learning with or without neural networks, starting with the first week after birth to predict preterm infants at risk for the development of ROP to decrease the rate of routine ophthalmologic examinations. That's one of the goals. And determine prospectively whether this predictive tool can be validated and used to select those infants most likely to benefit from early nutritional or pharmacologic interventions that might decrease the risk for interventions with Avastin or laser or surgery. So, for example, let's say that someone wanted to do a study on these premature babies, and they wanted to do a prospective randomized controlled trial. The number of babies actually getting laser therapy or getting Avastin in certain countries is very low. In Japan, it's actually fairly high, largely because they have so many very, very preterm babies. It's about 15%. That's a good number. But if you have maybe only 5%, if you want to do a prospective randomized trial, that'll take 2,000 babies, okay? Not so easy. But if you have a risk index, if you can get rid of some of the babies who are not at very high risk, but only those that are at the highest risk, then you can actually do a much more pragmatic power analysis in these kids and have a much lower number of babies for a randomized controlled trial. And last, I want to talk a little about nutrition. And this is just a legend quote by Hippocrates: our food should be our medicine, and our medicine should be our food.